Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about something very near and dear to my heart. It is an experience I had this week that I'm going to share with you. We're going to talk about diabetic eyes. That's going to be the title of this podcast. For many years I've been practicing, almost 40 years, and I've been treating a lot of diabetics, many thousands of diabetics. I've raised 2 type 1 diabetics myself, along with Jenny. And I've always warned patients about the complications you can have with diabetes, like blindness, kidney damage, heart disease, increased risk of dementia, loss of limbs, like amputations from infections. All this stuff you talk about your diabetics. You do foot checks. You get them to get their eyes checked. You check their heart out. But this week I got a first-hand look what it can do to your eyes. My daughter, who has type 1 diabetes for almost 30 years now, called me late at night and saying that she could barely see out of one eye and that it was getting worse. And of course this worried me because of diabetic retinopathy. She's had eye exams all along and they've been good. But anyway, so this thing was getting progressively worse, so I drove over to her town that she lives in. It's not that far. And I dug out my ophthalmoscope, and under the tutelage of a good friend who's an ophthalmologist, I examined her retina. The problem was I couldn't see her retina. All I saw was black when the other eye was red, and I examined the other eye. It had good vessels and nice pink retina. The other side, completely black. She could not tell you this was one. And so, of course, with the guidance of a couple of my good ophthalmology friends, it wasn't like an emergency where you need to go to the emergency room, fortunately. So brought her back home, propped her up. She slept in an upright position. The next day we went to see a retinal specialist. So the diagnosis was immediate. He was right, and thank you for the help that I received from Steve and Joe and then Mike. So the diagnosis was vitreous hemorrhage and causing about almost total loss of vision in that eye. Still can't see out of that eye. It's going to resolve. There's going to be treatments for it. But, of course, the cause was diabetes with her eye problem. And there are other causes for this, like retinal tears or detachments, vein occlusion, ruptured retinal artery, macular degeneration, tumors, sickle cell crisis. But in her case, it was pretty cut and dried. Diabetic retinopathy was the cause of that. So after keeping her calm and propped up all night, we went to see the retinal specialist, who after a few tests confirmed the diagnosis. Her diabetes was the cause of this hemorrhage, of the bleeding. And hopefully it will resolve and she will regain vision in this eye. I'm hopeful that she will. I'm sure she will, especially with the treatments that we have now. In her case, it will involve a series of injections, shots in the eye, followed by laser treatments and close follow-up. So how does this happen? Well, glucose in your blood damages all blood vessels, from your heart to your kidneys to your brain to your limbs. The vessels in the eye are so small that sometimes they're the first ones that are affected, and certainly that's the case here. It causes the vessels to become blocked and leaky. We call it ischemia, meaning it's not getting enough blood supply and oxygen. This can first be detected in diabetics on routine checks, and they're called cotton wool spots. I'm pretty sure she had a couple very small ones last year on her diabetic eye exam. But it can herald a problem, so you need to get a hold of this. The ischemia triggers something called a substance that's released called vascular endothelial growth factor, VEGF. You've heard me talk about it before. It stimulates new, however, fragile and weak blood vessels that are prone to bleeding in the eye. Now, VEGF has some other good purposes like healing wounds, but in this case, and for most cases, it's not really a good thing to have. So that's what caused these weakened proliferative vessels are the ones that bled. And you don't want these vessels popping up all over your retina because they're not like normal vessels. It also causes scarring and tractional retinal detachments. So these shots she's going to be getting in her eyes really are called anti-VEGF shots because they decrease the release of these abnormal factors. Actually, they're cytokines, and therefore decrease the proliferation of these fragile, leaky vessels. They also use this to treat wet macular degenerations. You'd rather have dry macula than a wet macula. They're both not great. They come with aging. But this thing we're talking about comes with diabetes, which can be treated and prevented. Then, after these series of shots, they'll do laser treatments to shrink these abnormal, fragile vessels and prevent new ones from growing. Surgery is a late option. Hopefully, won't have to have this. But the whole point of this is to educate you and also to prevent this from happening. I want to urge you, if you're a diabetic, that you need to prevent this from happening. And of course, all diabetics need yearly eye exams to look for these things. And to prevent this, the way to do it is to control your blood sugars. And I'll say this again, I've said it many times with my patient. It's not only the hemoglobin A1C, that 3 months average of blood sugars. It's the spikes that cause the damage. So controlling these blood sugar spikes are the most important thing. And that's why most diabetics, most everybody ought to do this, I think, is wear a continuous glucose monitor. I've done it several times. I'm surprised at what spikes my sugar. Everybody's different, but a CGM, which now you can get over the counter, a Stella, and there's another company that's making them now. It's so important to look at that. So please realize that it's those spikes that do the damage. Having diabetes in general is hard, especially type 1 diabetes. You just can't ignore it at any time. You have to really follow it. It's like constantly tending a fire. You can't ignore it because in the end, you're going to have problems if you do ignore it. So diabetic retinopathy is the leading cause of blindness for working age Americans. Think about that. That's the leading cause of blindness in Americans from age 20 to 74. Very, very important that you control your diabetes. Diabetes is so common. I bet 25% of the patients I see every day are diabetic or at least pre-diabetic. 1 out of 4 Americans with diabetes doesn't even know they have it. Worldwide, I think it's like 44% of diabetics don't even know they have diabetes. And it's a major cause of blindness worldwide. So the whole point of this thing is to tell you about the experience I had with Kelly, and hopefully it's going to help somebody else from, going that route. It's not Kelly's fault. She's done great with her diabetes for 30 years. It's just type 1 is especially hard on you, especially that damage can kind of build up over time, but it can be prevented and it can be treated. So I would always choose prevention over treatment. So I'm hoping that you, even if one person listens to this and realizes they do have diabetes, or if they already know it, please go see your eye doctor and take your diabetic control seriously. So I hope this helps somebody. I'll see you next week.